In today's video, we're going to talk about orthodontic rubber bands, which are also called elastics. The purpose of elastics are to get the teeth to fit together properly. Elastics move the upper teeth relative to the lower teeth so that the bite may be improved. Elastics are also helpful in redirecting jaw growth. These little rubber bands don't look like much, but they're a very important part of braces. Just place one of these little guys on your finger for a few minutes and you will feel that it really does have the force that can move your teeth. Unless otherwise instructed by Dr. Staggers, elastics are worn all the time except when eating and when brushing. Since elastics are rubber products, they wear out quickly and should be changed at least once a day, but can be changed as often as you would like. The first thing you want to do when placing elastics is to take it out of the package. And what you want to make sure is that the elastic is just one and not two stuck together like this. When you look at this carefully, it's actually two separate elastics. So if they're stuck together, you want to pull them apart. If you have the colored elastics, they're a little easier to tell whether they're stuck together. On the ones that are tooth colored, you just have to carefully look to see and make sure that you just use one elastic. When placing the elastic, I like to put it between my index finger and my thumb. And then when I come to the mouth, I like to put it on the back band first. So you catch the hook in the back and bring it up to catch the hook in the front. And it doesn't matter whether you have it as a continuous circle or whether you twist it like a figure eight. When placing the elastic, I like to start with it between the index finger and the thumb. And I think starting in the back, whether it's on the top or the bottom, depending on how Dr. Staggers tells you how to wear your elastics, I think it's easier to put it first in the back. So I slide it along the gum tissue until I feel the hook and I catch the hook. Once I have it hooked on the back band, I bring it forward and attach it around the hook that's on the front. And it doesn't matter whether you have this as a loop or whether you have it twisted like a figure eight. Most of the time, the elastic in the front will attach to a little metal tie called a K-tie or a Kobayashi tie. But occasionally it will attach to a hook that is actually part of the orthodontic bracket. If you're having difficulty placing your elastics with your fingers, in the bag of elastics there's this neat little white tool. So you take the elastic and you hook it on the end so it's snug like that. Then you would bring it in the mouth, you would hook it on the back band and bring it forward and hook it on the front tie and then just pull this part off. For people who are having trouble getting the rubber bands in with their fingers, one of the things you can get is a pair of hemostats, and you can pick these up at Lowe's or Home Depot. You take the rubber band, put it on the hemostat, then you can catch the hook in the back and bring it up to catch the hook in the front. All of these elastics look the same, but actually they are different. Every orthodontic rubber band is small, but if you look carefully, some are longer and some are thicker. Each type of elastics has a size that is the diameter in inches and a force amount that it applies when it is stretched in ounces. The size and force is listed on the package. Package also has a picture or a name on it so that it is easy for you to remember the correct size that you are wearing. It is a lot easier to remember that your bag of elastics has a Japan on it rather than remembering that you wear a 1/4 inch, 4.5 ounce elastic. Some companies have animals on their elastics, others have countries or colors. The key to success with elastics is to think of them in the same way as you would think about medicine. Medicine doesn't work if you don't take it correctly, and the same is true for elastics. Only wear your elastics in the manner that was prescribed by Dr. Staggers. Do not double up your elastics a few days before your orthodontic appointment to make up for lack of wear. This would be the same as taking a double dose of medicine because you forgot to take it on a regular basis. A double dose of elastics is bad for your teeth. All elastics look similar, but as stated before, they can be different. If you borrow elastics from a friend because you forgot your elastics or you ran out, the borrowed elastic may not be the right size or strength as yours. The only way to assure that you have the correct elastics is to compare the size and force that's listed on the package. So it's not just a good idea to borrow elastics from someone else. No one would ask a friend for their medication if you forgot or ran out of your medicine. It would like me saying, all these white pills look the same, so just pick one. There are many patterns to wear your elastics. A common pattern is from the back of one arch to the front of the opposite arch. The pattern that is seen in this picture is called Class 2 elastics. Class 2 elastics run from the back of the bottom teeth to the front of the top teeth. Class 3 elastics are the opposite of Class 2 elastics. Class 3 elastics run from the back of the upper teeth to the front of the lower teeth. Sometimes elastics will run in patterns such as V-shaped or box-shaped. An elastic that runs across the front teeth is usually for correcting the dental midlines, which is where the two front teeth come together. I hope you found this video about elastics helpful. If you have questions about your rubber bands, please give us a call at Julie Staggers Orthodontics. Please keep in mind that the purpose of this video is for educational purposes only. It is not a substitute for an in-office consultation with an orthodontist. Thanks for watching.